with that said, I'd like to go ahead and dive right in and send over my first question. So Commissioner, when we first had our event focusing on the impact of COVID-19 on vets back in May, the Department of Veterans Affairs was reporting having over 1,200 active cases, treating more than 9,000 patients, and was reporting nearly 1,200 total deaths. Since then, we've seen more than a 300% increase in active and treated cases, as well as a 50% increase in deaths. However, that's just folks that have access to VA, which is only about half of vets, and then those that actually use VA healthcare. So we don't fully have a robust understanding of the impact COVID has had on the veteran community, especially here in New York City. So my question to you, as someone who's been on the ground responding to the needs of veterans and their families during this difficult time, can you paint a clear picture of the total impact COVID has had on vets here in New York City?
Once again, Derek, thank you so much for having me today. And just thank you so much to you and to the folks from the Health Foundation for making this event possible. You know, when we think about what's going on with COVID and how it's impacted our veteran community, the insights we've gained from it have been from outreach that we've done, calling our veterans one by one, to the tune of more than 12,000 veterans thus far over the past few weeks with our Mission Vet Check initiative. And so for us, as far as real-time data points of the really more than 12,500 that we've called, we keep asking people, what are your issues? Where can we be of value? How can we help? And there's an underlying piece of it which goes back to connection. As far as many of the folks we call just say, hey, look, it's good to be able to have somebody to talk to. I'm at home right now. I've not been able to get out. And let's not forget a large number of our community members are older than the age of 65. As far as more than half of our veterans are senior citizens. And so we've gotten that as an undercurrent of just the connection piece, which kind of ties to behavioral or mental health. But then the most common requests have been food assistance, no knowledge of the COVID testing locations, and also emergency financial assistance. So speaking of that sampling size of those whom we've reached out to, the number one undergirding piece is just connection. But beyond that, it's requests dealing with food assistance involving, hey, where can I get a COVID test done, and emergency financial assistance.
No, thank you so much for that. It's super helpful for a lot of reasons. Perhaps most obviously because it's tough to respond to something that you don't fully understand. So now that we have a better understanding of the impact and needs created by the pandemic, as you mentioned, connectivity, food insecurity, just finding locations for where to get tested. My second question would be, how has DVS specifically been responsive to these challenges?
So, you know, just to speak to them piece by piece, as far as the connection piece, there's the Mission Vet Check initiative, which is leveraging, started out with leveraging National Guardsmen as callers, and now working with volunteers to help make calls to veterans, mostly veterans who are volunteering to call and reach out to other veterans, just to have that initial touch, where ultimately connection is one of the main things that's coming from it. And, you know, as far as, you know, when it comes to connection, another piece for connection for us is our Veteran Voices Project, where we're actively collecting the oral histories of veterans, of members of our community, that they might be archived with the Library of Congress. And just that act, while it's a remote recording, so it's just me talking to someone else who served about their story while it's being recorded, that act alone, it's something that does a good things for the soul as far as the connection piece and making sure we capture the history of our community. When we think about food, a couple of things we've done in way of food, we've had several members of our staff trained in the Get Food NYC program. In other words, if you reached out to someone from DVS, we are equipped to be able to tie you in with the city's food feeding program, where they'll basically sign you up to receive meals either 1 or 2 week basis. And then at that point, you can continue to re-up and continue to receive meals. So we've had over 320 veterans whom we've tied into Get Food NYC. Also, earlier this past spring, as the pandemic was really first taking off, we're fortunate with being gifted 5,300 pantry boxes, which had 2 meals apiece. Pantry box, Derek, meaning that it has non-perishable items, things where if all else failed, I have something to eat at home. And so we were able to get those 5,300 pantry boxes out to various members of the community, working with our Veteran Service Organization partners. And most recently for food, we have tied in with an effort that is really in partnership with the New York State Division of Veteran Services, with the Campaign Against Hunger in New York City, which is a Brooklyn-based feeding operation, and with the company HelloFresh, where we are taking configured meals and getting those out to the community at the rate of 350 to 400 meals per week, where HelloFresh as a business is the kind of business where you would subscribe and you receive all the meal and things that you need, and you would follow the instructions and cook that food. We're receiving a truckload of this type of food, have volunteers who pack it all. In other words, you take the box of frozen chicken, take each frozen chicken out, take the box with the frozen bags of rice, take each bag of frozen rice out, take the box with the frozen bags of vegetables, et cetera, and you put together about 350 or 400 of these and then get those out to our partners as well. We're set up to be able to do that through at least September. And that's a situation where as we do more and as we feed and help more people, HelloFresh is committed that this is what they want to be their major effort in New York, as far as the feeding of veterans in New York City. And this is the same initiative that's occurring in Buffalo right now. And so those are ways we're trying to get the food piece knocked out and get that in front of people. For COVID testing, we always inform folks of the various COVID testing sites and where they can receive that information. We also direct them to resources on our website, where we have a COVID-19 resources page, and we direct them to the city's broader website, which has details about COVID-19 testing. And then as far as the financial assistance component, for financial assistance, a couple of things that we pull out when speaking of this. First and foremost, we tell our veterans, look, go and seek out our supportive services veteran families partners, SSVF partners. And I'm speaking of Help USA, Jericho Project, Services for the Underserved, and Volunteers of America. Currently, they've got the funding to help veteran households that are underneath a certain income level be able to receive support as it pertains to housing insecurity. So if you're in a situation where your income for a family of one, if it's $39,800 or less, and if you can just show documentation, say, hey, look, my current income is less than $39,800 per year. Yeah, they'll look at you, and they give it as a family of four, it's $56,850. So if the income for that family of four is $56,850 or less, then these SSVF providers are able to work with you. And don't think of it in terms of, well, my income a few months ago was a certain thing, or last year, the year before was certain things. Think of it in terms of right now, my annual income is X. That triggers that ability to receive help. Another program we refer our veterans to is the home-based program, which falls under the Human Resource Administration, whereby additional support is provided as far as issues that involve housing and security. And yet another one that we bring folks to is our friends at the New York City Veterans Alliance, who through generous funding through the New York State Health Foundation have been helping veterans on a case-by-case basis who come into issues where there's some financial pain points that need to be resolved. So that's just one of several different resources we put on the table, just a few as far as financial assistance. All of this is on our website. If you go to nyc.gov/vets, there's a tab there for COVID-19 resources, which I urge all who are listening to click, where you can see where to go for these types of things.
Thank you so much for that. That's so comprehensive. And I think it's very reassuring, because when we've heard these conversations or been part of these conversations, the recurring theme is it's so comprehensive. There's so many things. It's not just one issue. So it's great to know that not only you have a grasp on what they are, but you're also addressing these issues as they come in. And we have some great questions coming through. I appreciate you giving the plug for the website. We had some folks asking for that. So please check out the chat box. And if that doesn't work, we'll get it to you by other means. But our friend Joe Hunt at the Veterans Mental Health Coalition, he had just a clarifying question as far as contacting folks. Was it 12,000 calls or 12,000 folks contacted? Do you know?
Good question. Good question. So it was more than 12,000 calls, and that generated about over 300 service requests. As far as it's beyond each caller has a script of different resources. As far as I'm on the phone, I'm talking to you, I can tell you where to go from here. If it's to where I'm not able to handle it with the script I have of various resources and things to reach out to, then I'm going to bring it back to DVS. And that's where we've gotten over 300 or so of these service requests so far that we've been fielding, where it's a little more involved in the issues. Yeah.
Gotcha. Thanks so much for clarifying that. And thanks to everyone else that's chiming in with the questions. Really appreciate that.
This is a two-way street, too, just to put it out there. Sorry, Deb, just to jump in, you can call us also at 212-416-5250. That's the number for DVS. To call us at 212-416-5250. If that's one way to reach out to us, as opposed to us just calling, if you need to reach us. And you can email us at connect@veterans.nyc.gov. So connect@veterans.nyc.gov. I'm sorry.
No, don't apologize. That's what we're here for. I appreciate you sharing that with us. We'll be sure to get that in the chat box as well, so folks can use that as a resource and also share amongst their peers as well. My next question for you, it's kind of crazy to look back on this, but you and I met back in October, right before you took on your current role. And I remember us chatting about hosting this event in person, but we thought, hey, let's give you some time to kind of get settled in, and we'll shoot for April when things will be less busy. And it's almost comical to look back on how it was, April was the antithesis of being not busy. So I'm a little reluctant to even attempt at predicting the future yet again. But can you offer any insight into what you see the back half of the year looking like, and specifically how DVS is preparing for the months to come, considering you have so much momentum regarding things that you already mentioned you're doing?
I think when it comes to the back half of the year, Derek, I guess what you said was we say in the military, no plan survives first contact. So we all thought we knew what was going to come, and things have been a bit upended. I think when it comes to the back half of the year for us, the focus is, let me answer it a different way. Whenever I think of this agency and the things that we do, I think of it in three different ways. I think of it as we're either connecting veterans to opportunities, we're cultivating an environment where opportunity is realized, or we are, stepping in to certain gaps to fill them ourselves if that gap is not being covered in other places in the ecosystem. And so when I think about the back half of the year, where I'm mindful of is what's going to occur next as far as this pandemic and where we're going, especially with the eviction moratorium preparing to end, especially with the folks who are receiving unemployment, that extra $600 per month you're receiving on top of your unemployment insurance is going to taper off. And so I'm just mindful of what are some of the major needs where we can play a strong role there, which is all the more reason why we're very much active with our housing partners in that space to make sure that, we help veterans not worry about the housing and security pieces as things emerge. Also, as far as the job front, we're very concerned with making sure veterans have access to jobs, to good opportunities there. There's so many different things that we like to promote there. Just to name a few, our partners at SBS and the Workforce One initiative, we always say, hey, this is a good place to go as far as receiving support and one-on-one care towards trying to get back in the game on the job side of things. Our partners at the Mayor's Office of People with Disabilities have an excellent program for anyone who has a disability known as NYC at Work, where these are employers that are looking to hire people with disabilities, recognizing there's rampant discrimination against that group. We have employers who stand up and say, I want to be here, even in these times, and offer employment opportunities. And then another one that I'd mention is one of our Vet Connect service providers, GI Go Fund, has an initiative known as Empire Vets, where they are saying, look, go to this website, enter your basic information, and we will pull whatever your MOS data was, in addition to your civilian information, and say, here's what we think the best jobs are that you should look at going forward. And there's several thousand jobs listed there also that are active. With Empire Vets, I know that they're also actively looking at remote jobs. You have people in positions where the most desirable option is a remote option. So I know that they're trying to flood that system with remote offerings. So even if you live in New York, you may be able to work for a company that's based in Texas or based in Idaho or based in Missouri, yet be okay. So when I think about the future, I kind of think of it in the near term about what are some of the twists and turns we see coming with this COVID pandemic from the public health side and from the economic side, and how do we get ready for them? And another thing too on the public health, fortunately, there's a company called Boomer Naturals, which through them and the Joe Piscopo radio show has donated several thousand face coverings to the New York City veteran community. And working with several of our partners, different veteran service organizations in the city, we've been distributing those types of things, those masks, when it comes to things that involve the public health aspect in ways that we are able to provide value. We've also been adamant about making sure veterans know where to go for. It's one thing if you qualify for VA healthcare, but if that's not the case, if it's about the New York State of Health, and in other words, our state's Obamacare platform, we're happy to let veterans know where to go there for that Get Covered NYC initiative, which is recognizing that the enrollment deadline was extended by the governor, such that you still have open enrollment in Obamacare. That is something that's available for New Yorkers who need insurance right now.
Gotcha. Thanks again for that. Super comprehensive and again, reassuring. There's just so many things going on. And I think a lot of us are looking towards the fall and not really knowing what is going to happen, but to know that you're already anticipating, you're kind of seeing, the writing on the wall and building up for that. It's really encouraging to hear. We did have one question. This is a little maybe hyper specific, but a guest asked, they have a veteran client that's 1 year behind in their rent. Do you have a specific entity in particular that you think would be best to assist with that?
So we've been pushing people to SSVF providers because the CARES Act effectively set things up with the SSVF providers where they have more funding than normal to assist veterans who are in certain circumstances. And the trick is that they've got until the end of this month. As surely as the unemployment insurance that was given will run out on, as far as the federal $600 bump, that's going to run out July 31st. That ends. A similar analogy can be applied to our SSVF providers as far as the spot they're in where they've got money to be able to do things and help people, but their funding will, based on what we know now, it will go back to whatever its regular levels were come August. And so that's why we tell people go to SSVF. I think that for the home-based program, which our Human Resource Administration runs, that they are getting ready for the eviction moratorium to end. And as such, they are trying to, make sure that anything they can do, I can't speak to what another agency is able to do as far as an entire year of rent arrears, but whatever they can do to be able to provide value, they're seeking to do as well. So I would recommend folks go look at the HRA's, the home-based program as well, which we can get information out about that. I can't fully speak to an entire year. I can say that there are people who care about helping veterans as much as they're able right now with lots of these issues.
Of course. Thank you so much for that. And again, thanks everyone for chiming in with your questions. I have a few more for the commissioner, but please send over some additional ones so I could send them his way. My next question, you kind of, touched on it quite a bit, and it's really looking at, partnership throughout this. So we know, an outline of what the future work needs to be. And unfortunately, there's just no one single entity, be it DVS, VA, you name it. No one's going to be able to tackle all these complex issues at once. So I'd love just to take this time to maybe just shout out any other organizations that you have been partnering with that you feel have been really stepping up and doing a great job, or other organizations that you can just bring up just so folks, it's at least on their radar.
I'll start, and then I'll come back and get a much more comprehensive listing of it for you in a second. I'll pull it up, but I mean, just to name a few, I'd be remiss if I didn't call out our friends at the City Council, who've been a great resource also as far as when people are coming up, them acting as a switchboard along with us and making sure folks know things. Also want to speak to our friends at the New York State Division for Veteran Services as a strong partner in the mix here. Our local VA, partners have also been very much thorough is within the various venues and vehicles they have that they make available. And then you look at our various American Legion, Disabled American Veterans, Vietnam Veterans of America, Veterans of Foreign Wars posts, which we've been tying in with. You look at the various vet centers as well, which have been excellent partners as we've just worked to get the word out to people about initiatives. I think about groups like Sage Vets for our older LGBTQ veterans. I look at Black Veterans for Social Justice, which is really a catch-all organization that works to support veterans regardless of race, regardless of gender, et cetera, around the city. I feel like there's too many to go. Even in Staten Island, we've got the Staten Island's Performing Partner System, which we've been very closely working with on issues involving veterans' mental health, trying to set up a paradigm that we can hemorrhage or expand throughout New York City on the subject of crisis intercept mapping. What to do when a veteran's in crisis? What are the next steps that we can take that all in the ecosystem have their games together so we can achieve ideal outcomes? And I look at Staten Island for that. Also, of course, our friends at Northwell Health, who, through their outreach are very active in the veteran community, not just from a public health perspective, but also as an employer of veterans. I can go on and on. I got to get the list right, but I'm just put me on stop right there, but I can keep going. And then I mentioned our SSVF partners as well for the supporting services of veteran families, between groups like Services for the Underserved and Help USA and the Jericho Project and Volunteers of America. It's really, and then of course the New York State Health Foundation. I'm so happy that utilities have been an issue that comes up also at times, Derek. And when they do, we point people to the Veterans Alliance. And that's is a partner of itself to call out the Veterans Alliance. But fortunately, the funding, the support they've received from the foundation, they're able to help particularly on this utility issue when folks say, hey, I'm behind on my National Grid or my Con Edison or my PSEG Long Island bill, and here's the story. And we work to help them there after we've accounted for any other offerings and programs that those utilities have. I hope that answers some of it. That's just the tip of the iceberg. There's so many more, and I'm so sorry I can't name them all right now. Yeah.
No, don't apologize. That's such a great list already, and it makes sense. You know, DVS has always been a natural partner for us at the foundation because we have worked with a lot of these great organizations, like you mentioned. Certainly, Mission Continues with VetCheck, the Veterans Alliance, the folks over there just do amazing work, and so many of the folks that you mentioned. I'll send one more question your way, and then we'll turn over to audience Q&A before we wrap things up. So again, thanks everyone sending questions. Feel free to keep those coming. Last question for you, kind of very general. But how have you been doing? How has life been for you? What have you been leaning on that's been helping you get through this? And any advice for other vets out there? Because I think, you know, we're all in this together, and I think the more we share, it's usually helpful for everyone else.
Well, I appreciate you asking. I think for me personally, it's been just adjusting to this new normal has been, you know, I don't want to say a challenge. It's really, you know, I'm here on this call. I'm a commissioner, but I'm also a husband. I'm also a father. I'm also a son. And for me, it's been just making sure to stay connected with my family as far as my wife and my young children who are with me, but also to stay tied in with my distant relatives and friends, also to try to make that a point to keep reaching out to people. Especially, I have some friends who don't have anyone at home right now who are very much isolated, and to try to just send a text here and there, just shoot an email, try to get on the phone and check in with folks has been something that's helped me personally, and it's been helping me while also helping them. And then one other thing that I've done, just more of a personal thing, I've tried to get better at just journaling. You know, not writing War and Peace every single day, but just putting a few comments down just to kind of remember this time and what this has been like and what we've been going through. And that's been cleansing for me personally. It's just something I've done.
Absolutely. No, thank you so much for that. I really appreciate it. And ton of great questions coming through. One from Damon McCool. He's actually a really great historian working at Eastern State Penitentiary in Philadelphia. And he asked, can you speak to the unique challenges facing formerly incarcerated veterans and maybe any work that DVS is doing to address those challenges specifically?
When I think about, you know, unique challenges for those who are incarcerated, and just as by way of just put it out there, prior to coming to this job, I was teaching an entrepreneurship class to veterans who were in the veterans wing at Rikers. So when I think about, you know, some of the challenges some of the vets face, it's this, you know, we already are, as veterans, there's implicit bias against us because people automatically assume that we are better with machines versus with people. And that's something that there's studies that have shown that over and over. So you've got that one thing. Then you've got this next piece of, you know, the bias, assuming that, oh, this person they are, you know, tainted or they're a negative member of society because they've served, and not looking at it in terms of this person has paid their debt and now the debt is clear. So you've got that whammy. And then on top of it, recognizing that many of our people who are incarcerated are people of color is the prism of race that this comes through for many of our men and women. And for us, as far as what we're doing specifically on this issue, it's been more so working, you know, alongside our partners at the state's Division of Veteran Services. They currently have offerings where they work to ensure that, you know, if someone's benefits from, you know, if someone is incarcerated, that their benefits are transferred, you know, at least to their spouse while they are incarcerated, and that when they come back, because technically what the government can say to you is, look, you're receiving benefits for your disability or whatever, but while you're a ward of the state, we don't have to pay you any of these things. And so something the state does very well is help people get those benefits back, and on case-by-case basis, have those benefits conferred to their family members. That's something else it touches that I didn't mention earlier, which is that we have, you know, recently been certified to process VA claims. So as far as things that regard service-connected disabilities, a certificate of eligibility for education, and VA pension situations. That is something that we are now doing in the organization. We're going to be more open, or just more rolling out a stronger campaign to let folks know about that in the months ahead. For now, there's been such a backlog with our colleagues at the state's Division for Veteran Services that we've been taking appointments from that backlog just to try to get that queue down. And our goal is that as that is knocked down over the next several weeks, that we will be able to start taking more appointments from people who are starting from scratch, saying, hey, what can I do to be able to get this money that is owed to me because of this disability that I incurred, or this, what I put my body through while I served? How can I be able to get that funding? For more information on that, I just urge people for now to call us at 212-416-5250 or email us at connect@veterans.nyc.gov. And more is going to follow there. But for now, we've been, since July 6th, processing claims, but just working to chop down the backlog, because the state also has folks who do this type of work, but there are months of backlog there, and we're trying to get past that. So we should be able to take new people on once that's done.
Gotcha. Awesome. Thank you so much for that. We have a ton of great questions and unfortunately not a lot of time. But fortunately, I do know a lot of these folks. Marcel, thanks for reaching out. Wanting to learn more about specifically just financial aid, which I'd love to be able to chat about. So hopefully this will be an ongoing conversation, staying with issues for student veterans returning to campus or coming to campus for the first time, virtually or in person. So a lot of issues there. So I appreciate everyone chiming in. And please reach out to us so we can follow up with these questions in more detail. And thanks again. If I can give you just about a minute or so, just kind of closing remarks, anything to wrap up, anything to shout out, or seeds to plant while we have you here?
I think the business end of this, for folks who had questions for following up, please don't hesitate. Just email us, connect@veterans.nyc.gov. So we will get back to you. I'm a notorious inbox zero person. In other words, we respond to what we receive, just to say that. Another one, speaking of which, you know, a message I want to try to convey everywhere I can is that the service did not end when you took your uniform off. In other words, wherever you are, whatever you're doing, we encourage you to get in the game and continue to help others. You know, there's something, this population is so unique because it's in our DNA, in that we've already, you know, committed everything to things greater than ourselves. And I just ask that people continue to do the great work that you have in your soul to do through whatever venue. I mean, there are opportunities for volunteer work through us, with helping us with this food that we push out every Wednesday, or with making calls from your home for Mission Vet Check, or recording someone's oral history. You can always email us to learn more. But even outside of DVS, any and every opportunity you have to be able to just give of yourself, I just encourage you to keep doing that. I feel like if everyone took that approach, we will be in a much better place than we are now, and we can continue to get to a better place. So that's, that's just my 2 cents for the last minute.
I appreciate it. I think it was worth much more than 2 cents. Thank you so much, Commissioner. Again, I'd like to thank you personally for your time today. As you mentioned, service doesn't stop when the uniform comes off, and you're a great example of that, continuing to serve in the community and really be a leader. So we appreciate your time and your continued service. And also like to thank all of the folks in the audience as well for joining us. Again, things are really hectic, so we appreciate your time and also the amazing questions. I look forward to responding to those as well, so thank you for that. And like I mentioned before, we'll be sure to shoot out an email with a recap of this event that'll include a link to the recording, and so please be sure to keep an eye out and share with whomever you think might be interested. Also, follow us on Twitter at NYS_health and sign up for our newsletter to hear about more of our awesome events they'll be hosting in the future. Our next one will actually be this Thursday, July 16th at noon, with Dr. Michael Hasselberg. He's an associate professor of psychiatry and clinical nursing and co-director of the University of Rochester Health Lab. Well, they'll be discussing the ROC COVID-19 initiative, which is an early identification tool that establishes a baseline for tracking symptoms and also identifying hotspots related to the pandemic. So please join us for that. Thanks again, Commissioner, for your time, and thank you everyone for joining us.
Thank you so much, Derek, and thank you everyone.